On today's episode of the Cruz Orthodontics podcast, Dr. Cruz is going to talk about everything you need to know about your child starting your orthodontic journey. Dr. Cruz, what inspired you to work with orthodontics, especially with younger children?
I don't have some amazing story where I was, greatly inspired at any one time. I got into dental school and I actually wasn't all that knowledgeable about the different specialties. And so fortunately, a couple of my classmates were much more in tune with what was available within dentistry, primarily because they had parents that were dentists or specialists. And so they introduced me to orthodontics and said, "Hey, Chris, you should check this out. It's a pretty amazing profession." And that was it. That was all it took. Once I realized what orthodontics was about, getting to work with all sorts of patients and drastically changing kind of their smile and their confidence, I was sort of hooked on it.
What do you think the most common age is for kids when they start asking their parents about braces?
Yeah, it's usually probably second, third grade. Youngsters will start to notice that their classmates will have braces on or various different orthodontic appliances on their teeth or in their mouth, and so they'll start asking questions to their parents about what that is and what it does. The other way that it happens too is that parents will get together and start chatting, and so oftentimes if a child would benefit from a phase one or what we call an early phase of orthodontics, it's usually happening around age 7, 8, 9 years old. And parents and kids start to kind of pick up on that with others around in the community.
What is the most common question kids ask during a consultation?
Oh yeah, that's an easy one. The top three questions are: Is it going to hurt? The second most common question is: How long is this going to take? And then, oddly enough, the third most common question is, can I pick my colors? And so the questions one and two are sort of logical to me, but it's funny how number three on the list is whether they can pick colors or not. And so things have come a long way within orthodontics. I think oftentimes what happens is parents will base their experience when they had orthodontic treatment and braces and sort of project that onto their children. And so sometimes we'll see kids come in and they're already nervous. The good news is that things have changed a ton for the better. Having braces or even aligner treatment is not nearly as uncomfortable as it used to be. And so we've got the opportunity during the initial consultation to kind of explain why things are so much better, and that usually puts everybody at ease, parents included.
Is there anything else you do for kids that seem really nervous about getting braces?
Oh, sure. It's all about taking advantage of that initial appointment, right? And so we schedule it out to where I get a lot of quality time with them. We want to make sure that I'm not rushing through this. And so I get to actually bond with the child and ask them questions about, what is it that you are worried about or concerned about? And then really listen to that question and answer it specifically, and do it in a fun, kind of lighthearted way. And usually after 10, 15, 20 minutes of doing that and educating them, it really goes a long way. I know it sounds basic and fundamental, but yeah, really listening to what their concerns are and addressing them. Once children and parents feel heard, the mood of the appointment and the relationship definitely changes. So that's what we do.
So a lot of kids worry about pain. How do you explain to the kids what it actually feels like?
It's a good question. There's probably a few kind of different levels to discuss. The first one is we want to make sure that we're not misleading children and we're being genuinely honest. So what I mean by that is that there is that initial week. It's usually 4 to 7 days where there's going to be some soreness. There's just not any way around that. Granted, the soreness is quite a bit less than it used to be, when I was a child. And we have these amazing appliances now. The one that we use in our office is called the SynapseX Dental Pain Eraser. And so rather than having to be dependent on, pharmaceuticals, Advil, aspirin, Tylenol, you have this appliance now that you can actually rub on your gums, and it sends little electrical signals to the nerves to calm the nerves down so that you're not in pain. So we've got some amazing things to be able to really minimize and reduce soreness. But at the same time, there is going to be some adjustment period and some discomfort. So we take the time to discuss all of that. And I think that that goes a long way, especially with the way that we reach out to our patients after a day, after a few days, to see how they're doing. Oftentimes questions will come up by then that they didn't think they had, and being able to answer that as well. So that's generally the approach that we take.
What foods do the kids need to avoid when they're getting braces, and how do you explain to them why those foods need to be avoided?
We try not to give a specific list of foods because the list could be, infinite. Instead, we sort of describe the types of foods that you have to be careful with. It's the three big ones: hard foods, hard candy in particular, sticky foods, and really chewy type foods. And so, hard, sticky, and chewy kind of covers most of the issues that can come up with potentially breaking an orthodontic appliance. And so we go over that at the initial appointment, and then we give them kind of a reminder list. And then, we also are one of the few offices, at least in Southern California, that uses what's called dental monitoring. So we give all of our patients something called a scan box. So every week they're scanning their teeth, basically taking photos of their teeth and their bite. And that gives us an opportunity to communicate with our patients. And so usually about a week into their treatment, sometimes 2 weeks, the soreness that they usually experience goes away. And so now patients' confidence in being able to bite and chew into harder foods increases. And so that's the appropriate time for us to send them a friendly reminder of, just a reminder, make sure that you're being careful with hard, sticky, and chewy foods. It's interesting. You'll see a real ramp up as far as broken orthodontic appliances like braces in that second and third week, because they're not sore anymore. And so, it's nice to give them a friendly reminder of like, hey, don't forget to be careful. I know you're feeling a lot better, but still be careful with the hard foods.
What about sports and playing instruments? What kind of advice do you give kids about that?
Yeah, my first advice is do it. Do all of those things. Absolutely. I think that we need more of that. And so when it comes to like reed instruments or horn instruments, you have to have a lot of lip pressure. And so we give all of our patients wax, and we also explain to them that there is going to be an adjustment period in basically toughening up the lining of their lips and cheeks. And that can take a few days, but after that, it's pretty smooth sailing. And then with regards to sports, it's key to have some sort of mouth guard for most of the sports that kids are playing. And so then we'll go into detail as to what type of mouth guard is best if you have something like braces. You don't want it to be too form fitting, because that can actually pull the braces or break the braces off.
Could you walk us through how you explain the braces process to young patients?
Absolutely. I think that with the younger patients in particular, you've got to take a little bit more time to make sure that they're comfortable with this process. And there's no magic behind it. It's kind of the tell, show, do. So, I'll briefly talk about the process and
Yeah.
how we put braces on, which, by the way, at our office, we do what's called indirect bonding, which isn't anything new by any means, but there are a lot of offices that still do it what I describe as the old school way, where you put the braces on each individual tooth one at a time, which can be kind of a long, lengthy process. And for a youngster, that needs to hold still for a lengthy period of time, it's a challenge to be able to do that. And so with this indirect bonding, you have everything kind of preset in this comfortable tray that you put in. So all of the braces go on at the same time. And so you can cut the process down, that appointment down, probably in half. And so we'll explain that to the youngsters, but then the show part is the key. We'll show them it almost looks like a mouth guard, what it looks like and how it comfortably fits on. And then we let them ask questions. And then at that point, you can tell that they're like, okay, I think I'm ready for this. And then it's kind of off to the races, and you do the procedure. The good news is that putting braces on isn't uncomfortable at all. And I think that there's that misconception that the actual process of putting braces on, or any orthodontic appliance for that matter, is uncomfortable. And it's simply not true. The soreness is what follows, a day or two after you've put the braces on. And so we have ways of being able to help with that too.
What surprises kids most about getting braces?
I think it's how easy it was. I think that I think a lot of kids are scouring TikTok and YouTube, and obviously the videos that are going to get the most clicks are the really dramatic videos. And I think some of these videos can intimidate and scare patients, and then they come in and they actually experience kind of the reality of it all, and they realize, oh my gosh, this was so much easier than either what I saw on my phone or what my friends told me. Or you'll have siblings, older brothers and sisters that can definitely hype up what the process is. And so they're genuinely surprised at how easy it was. Yeah.
How do you explain the importance of wearing rubber bands to kids?
The rubber bands. That's always a big one. Going back to this scan box, so what we do now, which is a really big shift to the way that a lot of other offices do it, is that we get the elastic portion of treatment done first. It's actually significantly more efficient and comfortable for the patient to get the elastic portion done first. So we actually don't put the braces on until the elastic part is done. There's an appliance that we love to use in our office. It's called the Carrier Motion Appliance. And so it's a little bar that goes on the sides of the teeth that you attach the rubber bands to. And so getting the bite corrected and getting the back teeth to fit together properly first is really critical. Going back to the compliance with the elastics, using the scan box has become so important for us. And so every week our patients will scan, and I can see the progress that they're making or not making with regards to wearing the elastics. And so we now have this ability to really communicate, send them photos of their own teeth, show them where I expect their teeth to be, where their teeth currently are. Some of our patients do an amazing job, so we celebrate that. Some of our patients need a little bit of encouragement, and so we're there to do that as well. And then what's been really interesting is that our compliance for elastic wear and also for Invisalign wear has ramped way up as a result of this scan box. Simply having our patients know that we have their best interest in mind and that we're watching their progress causes them to do exactly what we want them to do. And then the other key aspect to this is that our patients understand that they can't go on to the second step until the elastic portion is completed. So you can't get your braces on until you've done that initial step. And so that's also another layer of motivation for them.
What are some of your favorite tips for teaching kids the importance of brushing and flossing with braces?
I don't have any kind of special tricks. More than anything, it's really explaining to them the area of kind of brushing and flossing that's most commonly missed. And so generally speaking, that area around the brace is usually fairly clean. And then the area that's kind of away from the gum tissue, that's part of the teeth, so almost the edges of the teeth, is also generally clean. It's that band of tissue between the brace and the gum tissue. That's the area where food tends to get kind of stuck or caught. If you think about the way that teeth naturally cleanse themselves when patients don't have braces on, saliva will wash over the teeth and sort of naturally clean the teeth throughout the day. But when you put braces on the teeth, that flow of saliva is inhibited. And so now you need to really focus on that area that's closest to the gums. Once again, going back to that scan box, we're actually sending them pictures of their own teeth. And if they're missing particular areas, they'll do a great job in one area and then maybe potentially miss an area. We can circle that area and we can show them, and then we can send them a video reminding them of the brushing technique with the small circular motions. So there's no magic behind it, but using this technology to kind of strengthen the relationship and strengthen the communication has been key to actually having our patients improve their hygiene. Parents love it. The burden of a parent to have to focus on whether their child is doing a good job with brushing and flossing, while also focusing on all of the other aspects of parenting. It's just one more thing that makes things more difficult for them. And so now knowing that, hey, we've got this, we've got your back, let us handle that part of it. Patients are sending us messages through the scan box all the time saying, oh my gosh, thank you so much. It's one less thing for me to have to deal with.
How do you make follow-up appointments less intimidating for young kids?
The follow-up appointments really aren't much of an issue. I think that kind of what we were talking about earlier, the biggest issue is that initial appointment where we're delivering an appliance. That's
Yeah.
the big one. And once they get past that and we acknowledge what a great job that they had done, what I also like to tell them is that the hard part is done. That's the longest, most difficult appointment that you're ever going to have. And most patients are kind of surprised at how easy that appointment was. And so they're kind of prepped going into the next appointment, knowing that, okay, if that was as bad as it's ever going to be, and that was actually pretty darn easy, then this is going to be pretty smooth thereafter. We'll also obviously communicate with our patients via the scan box, letting them know what the plans are for the next appointment, that they're doing a great job. And so they already know coming in that there's a bit of a rapport and a relationship there, and that we're not strangers.
What's the most rewarding thing about helping kids through this orthodontic journey?
There's probably a couple ways to answer that. The first answer directly pertains to orthodontics. I mean, it's so satisfying and rewarding creating beautiful smiles, particularly for patients that had a smile or crowding that was kind of more on the severe side. I really enjoy those dramatic transformations that we're able to achieve. You can see the self-confidence rise as you go through treatment. I mean, by the time you get a quarter or halfway through treatment, they're different individuals. They're feeling good about themselves. They're not shy. And then the other way to answer that has nothing to do with orthodontics at all. It's really cool to be in this profession and see kids grow up, right? I get to see kids at 7, 8 years old, and it's not uncommon that I'll see them 10, 15, 20 years later because they need an adjustment on their retainer. And to see what profession they went into, to see them have children of their own, I love the aspect of being almost like an extended part of the family.
Wow. Yeah, of course. What advice would you give parents who have kids that are a little anxious about getting braces?
More than anything, I would encourage them just to come in and have an initial consultation with us. We are a fun office. I'm really lucky to be surrounded by an amazing team. The women that work at our office are upbeat and friendly and loving. They're all mothers, and so they have kids of their own. We make the appointment fun. We make it comfortable. We're not a cold, sterile office. It's almost like coming into a home. So more than anything, I just encourage them, come in and have a consultation. It's complimentary. And then that way you can get a better sense as to what the whole process is all about.
Do you have any memorable stories about a young patient's transformation you want to share?
Oh, sure. Lots and lots, over 20 years of experiences. There's tons of stories. There's always a few that kind of stick out in my mind. Um, there's a little girl who had a really prominent underbite. And so being able to fix that underbite with just orthodontics alone, no surgery, didn't have to have any teeth removed. I still remember the day that, unsolicited, when her braces came off, she gives me a big hug. It always melts my heart when I get to have situations like that, where that youngsters aren't just handing out hugs on a regular basis. And for her to do that and give me a big squeeze was just really rewarding. And another patient was somebody who had also a prominent underbite. He was older. He was in college, and he sort of struggled socially. And in this case, when his underbite was resolved, he was wrapping up college. He had a career set up. He had a girlfriend. He was on cloud nine, and he still comes back years later and shares with me how he's doing in life, just because of the impact that we all had. And so it's stories like that make this really fun, really rewarding.
Great. Well, Dr. Cruz, thanks for being on the show again, and we'll talk to you soon.
Yeah, my pleasure.